going through what I had to go through, you know, and if it's the will for me to go through it so that I can help somebody else know that they're not crazy or that, you know, what's happening to them is a real situation and it's more than just, you know, like I said, praying it away. So I want people to know that they're not by themselves, you know, they're not alone in this battle, you know. Excuse me, I want them to know they're not alone in the battle. There's a community out there of people who just really do understand and really, you know, want to be supportive and that gets what you're going through. And so that's kind of how I got into wanting to share that with
When do I have time to deal with my own depression, or how do I deal with it? How do I?
It's
and that's for anybody.
It's learning to prioritize, which can't be an easy thing to do. Okay, and feeling like you need to be there and be ready for everyone else, but they need to have others that can assist them, those that they trust in the ministry, you know, to be able to step in and do it. And I'm going to use this as an example. Moses' brother-in-law told him, he said, look out. And he said, find 70 that's full of the Spirit. He said, otherwise you're going to kill yourself. Well, if he told him that, what about us today? We still need help, okay? And you need to have people that are willing and obedient and are that you can trust in the ministry to be able to help people, okay? And that in itself is a job, and having those that can.
What I've noticed too with a lot of, I don't want to say mega preachers, is that if that preacher is not preaching, no one wants to be bothered. No one wants to come to church, so that main preacher can't get a break. Because if that preacher's not preaching, the tithes or offerings are going to go down, attendance is going to go down, so they have to learn to give themselves a break. But see, they don't have, just like in any position, if the person is gone, you always have to move. Someone should be ready to move into that position. But sometimes we put them on that pedestal and think they can be replaced. That's why a lot of them don't take the time to take off.
And then when they fall, the folk are devastated. So my question is, I asked this question once before when something came up, and they asked about pastors. I said, so my question would be, how many of us are praying for our pastors? Truthfully, you know, we want them to be there for us. They want us to pray for them. They want us to be there with our family when, you know, they want us to walk with us through this, whatever we're going through. But how many of us are willing to be there for them? Okay, this is a two-way thing. You know?
I was just sitting thinking, and I was thinking some of it is understanding of the word, and some pastors have gotten caught up in legalism and not faith, and so they feel like they don't meet a certain standard, and they're too hard on themselves about certain things, and so because of that, they put too much pressure on themselves, and I didn't do this and I didn't do that, and that shame and guilt comes in, and not remembering that God is a forgiving God, and God is a all-powerful God, and but because I haven't met this legal standard, He knew that you weren't going to meet it. That's why He died. And so I think some pastors have to try to not forget about it, because the legalism comes to convict, but faith gives you strength to, you know, walk through it. I think sometimes they get in that pressure.
So when you get caught up in the pressure, then this pride comes in.
Exactly.
And the pride will make you feel like, oh no, that's not me. I mean, I'm not going to do that. I don't, you know. But that's where the humility is going to be there, okay? You know, so that to recognize that their strength comes through the Lord Jesus Christ, you know, which is something
in 2000, I always forget, 2009, one day before my 1-year-old daughter's birthday. So I'm very careful with triggers. So I did take some pills. I was rushed to ICU. I did the whole stomach pump and all that. And I've had a couple hospitalizations, but that was my last one. So what's that? 9 years hospital free. Yes. So like I said, and get involved with different organizations. I mean, it's just not one; it's several out here. Of course, American Foundation for Suicide Prevention focuses on suicide, but you still need to know the mental health conditions as well, because that coincides together. So
the Alnicia's name to me, we brought her to mind. am I going to seek him to know whether or not I need to just pray or whether to call her and say, I'm just thinking about you? You know, things like that. And we seem to be missing it in that area, you know. And this is what real love is all about.
Yes.
Okay, the love of Christ.
Yes.
Okay, I don't care where he went, he was open to be able to assist and be there for somebody else. Okay, or if I'm so caught up in myself that I think it's all about me, then I'm not going to be concerned about anybody else. Okay, minister or otherwise. Okay, so again, it's all of us working together. It's a body fitly joined together. And if my toe hurt, my brain is going to let me know it. My hand is going to automatically want to go down and try to comfort my foot. Do we do that in the body of Christ? So in a lot of cases, that's missing. So we can't help anybody. We can't know if somebody is going through anything. You know, we don't have the interest to know a hunger and a thirst for other souls. Okay?
And people get lost in the congregation too.
Oh yeah. Oh yeah. Oh yeah.
In some churches. Yeah.
And when the first thing we says, oh my God, I didn't know they were going through all of
That's
that.
right.
Okay, so where is the discernment? Where is the
And that's why
prayer?
fellowship
Where
is
the-
important too.
Absolutely.
And not just Sunday morning, having engagement with your church family, reaching out and seeing, so that I not only see you on Sunday morning, but I see you on a Thursday night when you something might have been different and you present a different way. I see you when you're in a high stress moment, not just in here praising when all the like everything's okay.
And then some people don't want to reach out because they're afraid of being judged.
Yeah.
Let's call it like it is. You know, we want to jump all over them. Shut up, be quiet, sit down. And I don't use that word lightly, but be willing to listen. Okay? And it's missing.
I'm going to read some warning signs, and you ladies can jump in and give me any feedback.
Okay.
These are just some warning signs. Sleeping too little or too much, withdrawing or isolating, and I think Pastor mentioned that how people isolate. Showing rage or talking about seeking revenge, extreme mood swings, increasing the use of alcohol, talking about being a burden to others, talking about feeling trapped or unbearable pain, talking about feeling hopeless or having no reason to live, looking for a way to kill themselves, like searching online or buying a gun, talking about wanting to die or to kill yourself. Are there any other warning signs based on your experience that you think people should pay attention to?
I remember when I was going through call it like it is, my husband had gone to jail. Here I am with a premature child, but they're telling me that she has a lung disease similar to emphysema. If she lived, the greatest possibility is mental illness, all at one time. And then a son that's starting to act up. And I was functioning during today because of the children, but I wasn't sleeping at night, okay? And then you've got church folk, okay? I'm just calling it like it was saying that seek God to find out how much of this was my fault. That's some of the things that I heard, during that time. And I remember getting on the church bus and someone said to me, and the devil's already telling me, see, you're going to lose your mind, okay? You're going to end up with a nervous breakdown. You're going to go in a mental institution. Your children going to foster, and you're never going to see all this is going through. And I get on the bus and hear somebody tell me, you're as crazy as a buck. And the devil says, see, I told you were going crazy, okay? And so now I'm going into this depression that we're talking about. And I'm God, I didn't know where to go, who to talk to, whatever. But I thank God that along the way, because of some things that my son was going through, I got involved in counseling, okay? And we would talk about stuff. And so the question was in there, asked my son, how does he deal? He said, I go to my room and cry. He asked me, what do I do? I said, I go to my room and says, do you come together? That's why I keep saying it's important to come together, okay? And so I told my children, look, whatever it is you're going through, I need you to communicate with me, okay? Even if you got to holler, it's fine. We holler at the children, but then we tell the children they can't holler. You know? Now, you're not going to cuss me, disrespect me, but at least let me know what's going on with you. So I said, because when it's all over with, I'm the one that's going to be here, going to work through these things with you. So we need to let them know, you talked about young people, that they have someone that they can come to, someone that's going to be there to be able to walk through these things with them. You know, and unfortunately, a lot of them, we're so busy in making sure we got the nice cars and homes, I'm just going to call it like it is, and we send them to their room. Okay? And we're not spending the time with the children that should be, so that they better know how to deal with stuff as they grow. So then we do what? We got adults. They don't know how to deal with stuff because they didn't learn along the way. And this is what we're looking at. A lot of adults that are still stuck in the childhood, okay? Because of issues that went on that were never resolved. And then some of them go on to be ministers, and they still haven't dealt with the issues. So I've learned from that the importance of being compassionate. Okay, David said on one occasion, he says, it was good that I've been afflicted that I might learn thy statutes. And so there's blessings even in our afflictions, because it calls us to be more compassionate, more aware of the things that's going on around us, more eager to be a help to somebody.
And that help is, therapy. That help is psychiatry. That help is other communities that understand what you're going through. That help is being transparent with what's going on with you, and being able to say, you know what, and the one thing we have to come outside of our minds is, I can do this on my own. We have that sense that I can do this on my own. No, when you open yourself up and you really say, God, I can't do this on my own, that's when the help comes.
Yes.
That's where it comes from. Is being said, I can't do this on my own. I can't be the one-man shop in this. And God sends the help in different ways. And what helps one person doesn't necessarily help another person. And so that's why we have to communicate with one another, because some things I might say may help this person over here, but it's something that Anicia would say that would help someone totally different. But we're all helping. So that it's us coming together with these panels like this, that I believe God has put us together, because we're helping a range of people with different situations, different circumstances, and we are the help. And that's what I think we have to realize when we look at it on a faith-based situation. God has put us that we are able to help. I look at my kids, I have kids, and they already know how their mother is. And I see the symptoms sometimes when they start talking. My little boy, he starts saying little things. I'm looking cross-eyed at you. My daughter's in therapy because I'm like, nope, we're not even playing these games. No, you need help. And right now, I'm not able to help you. But we're going to get you some help. You need to talk to somebody. And, and that's me being a parent saying, okay, yeah, this is my child, but I can't do it by myself. I'm not in a position to help her. I can barely help myself sometimes. So, God, what do I do? Send her to a therapist. It's okay. That is the help. That is the help that we...
You know what? This just hit in my spirit, and I might upset some people. Praying it away, but you know what? Nothing is impossible that God cannot do.
No.
Right.
So sometimes we have to remember that. Sometimes He will answer your prayer, and sometimes He will not.
Right.
But prayer can break through some things that we could never imagine.
Oh, yeah.
But again, like I said, all our prayers are not answered. So maybe it's not meant for you to be healed at this time or this moment. That's just like anything else. I've known people that, stage 4 cancer, then stage 3, then, hey, sometimes, you got to work it together, because nothing is nothing impossible with Him. But you just can't pray and just be like, okay, I don't need to see my psychiatrist.
Right.
Everything
Talk
is
about it
together.
from two different perspectives. First, I'm going to talk to people who you may have a loved one or a family member who's dealing with a mental illness. And this is like, I'm reading from a little booklet that we wrote, and the bits and pieces of it are on our website, igbatt.com, under our latest blog. But getting help for someone. First of all, depending on where you live, symptoms, and previous history, you may choose to contact your local crisis team or 911. Okay? So when we talk about here in the United States, the responses are different, or they can vary. It depends on, if you're living in a city or a country, a big city, little city, the resources just vary. Okay, so that's one reason, let me say here, some of the things that I may be saying, you may not apply to if you live in Baltimore or you live in Washington, D.C. It may apply to you if you live in a small place in North Carolina, or it may or may not. So again, a lot of things vary. It varies with the type of insurance the person has, the time of day, believe it or not, that you go into the hospital, the person who's doing the triage, what the person says. There are a lot of different factors. But first, let me just talk about this statement here. Depending on where you live, symptoms and previous history. If your symptoms are acute, or meaning that you're psychotic, out of touch with reality, if you have a previous history, if you've been to the hospital before, if you already have a outpatient treatment team, it just varies what will happen. Now, crisis team versus 911. A crisis team consists of a group of mental health professionals who will, once you call, respond to you at your location. So the crisis team, depending on where you are, again, every area, every jurisdiction does not have a crisis team. Okay, but if you do, you can call the crisis team. The crisis team consists of a team of mental health professionals, normally a team of mental health professionals, sometimes 1, 2, or 3, and you call them and you can say, hey, my loved one is experiencing these types of symptoms, this is what is going on. The crisis team will come out, right? They'll come out, they'll talk to your loved one, they'll assess if your loved one is on medications or if he or she is connected with a doctor already. They may try to get in touch with that doctor. They'll counsel your loved one if they can get the loved one to take their medications, or basically they will come out and support you and assist you. Okay. The crisis team, after assessing a situation, can sometimes help to defray an inpatient hospital stay, encourage medication use, and stabilize symptoms until a clinic provider can see your loved one. So again, they'll come out, see what's going on. The crisis team can really be helpful when situations where you're a little iffy with. The crisis team, let me back up. Sometimes, however, the crisis team may decide that an inpatient stay is needed. If they do, they will help you arrange for transportation. And then it depends on if your loved one wants to go to the hospital or if he or she does not want to go to the hospital. So again, the next steps will vary. So the first thing you want to do, if you're living with someone or you notice someone, their symptoms are increasing, you have a concern about them, and you're thinking to yourself, I want to get this person help. You can decide to call 911 or the crisis team. Number one, the crisis team consists of a team of mental health professionals who will come out. 2, you give them a call, they come out, they'll assess. Based on their assessment, they may decide that your loved one will be better off in the hospital, and if they do, they will arrange transportation. Now, if your loved one does not want to go, to the hospital voluntarily, then the crisis team will have to call someone else. They will have to many times call the police. So when should you call the police and when should you call the crisis team? If you're dealing with a situation in which there is threats of violence, that you know your loved one will not go and is very aggressive, you might want to call the crisis team and then the police, because just so now you can call the crisis team for help. But again, if it's a dangerous situation, if there are weapons involved, you want to call the police. Because here's the catch. The crisis team, while they will come out, like I said before, they can't necessarily make your loved one go do anything. The police are the only one who have that ability to do that. So the police will come out if they need to. If you call them or if there's a situation. And when you call 911, you want to explain to the operator it's a medical emergency. We use the term medical emergency because they'll know that this is a psychiatric issue, right? So they'll come out, the police, and again, a lot of things can happen here. The police may come out, they'll talk to your loved one, and they'll have to make a determination. Now, I can tell you, the police in many jurisdictions, they take taking somebody by force very seriously. So, for example, if they come out and they do not see the behavior that you call them about, or if they, really iffy, they may not take your or force your loved one to go to the hospital. Okay. So I just want to let you know that, because keep in mind, a person has a right to not take their medications. They have a right to not to take their medication. They have a right to not see their therapist. So you can't call the police or force a person just for that. What you want to do is be able to talk about what is the impact of not taking their medications? What are the impact to the family, the impact to the individual, or the potential impact to the individual? That's what you want to mention, because you just can't say, well, he's not taking his medications, or he or she, and the police come in and your loved one is sitting there watching TV or calm. They're more than likely not going to take the person unless it's some very extreme circumstances. The same thing with the crisis team. Again, remember, when do you call the police? You call the police if there's an issue of dangerousness, the violence, very aggressive behavior. You can call the police. When you do, make sure you know it's a medical emergency. Tell them that it is a medical emergency, right? You want to be careful about what you say on the phone to the dispatcher. You want to say, hey, this is a medical emergency. If it's a loved one and you feel a person is not a danger to him, not a danger to anyone, you can say that, okay? There are no weapons. He or she is sitting here. They're just not taking their medicine. They're scratching themselves. They're whatever the behavior is. But this is a medical emergency. And keep in mind that when the police come to respond, the police, they're going to respond based on the information that they were given. Many times they do not know your loved one or relative unless they do, but most of the time they won't know your loved one. So when they come, they're coming in response to a call. It will be up to you to kind of give the police the information or convey the information that you want them to know, that you want them to have, and especially as they talk to your loved one. Now let me say something about the specially trained officers. In many jurisdictions, we have what's called, it depends, CTCIO officers, but again, these are officers who volunteered to take extra classes to become more capable, more ready to cope with individuals who are having a psychiatric crisis. Now, not all officers are trained to do this, so you can call your 911 and say, hey, can you send me an officer who is trained in, to handle or to work with people with a mental illness or psychiatric emergency. You can try it. If they have one, I'm sure they'll send one, but many jurisdictions don't. Some only have a few people. But let's just say you do get a CIO officer. Still keep in mind that this is still a police officer. So when that officer comes, he or she is going to utilize the training and try to de-escalate and to kind of calm your loved one down and do the things that they need to do. But if your loved one is experiencing aggressive behavior or dangerous behavior, then they're going to have to do what police officers do. And I think that's really important. I was working with someone and we had to call the police. The police had to come out, and the police officer was really great with the loved one. He spent some time with the individual, trying to talk to him, but the loved one wouldn't take his hands out of his pocket, and he started to become aggressive. So the police officer at that point, had to go from, I guess good cop, if you will, or nice cop, if you will, kind of talking to calm him down, to doing what police officers do. And he and another officer had to take the person down to the floor and do what they had to do. For the family members looking at this was kind of scary. It was kind of upsetting. But it was something that needed to be done, because keep in mind, again, the police officer does not know your family member. They don't know what's going on. It's about safety. Another thing to keep in mind, that if the police officers come and they have to respond, whether it's voluntary or involuntary, 9 times out of 10 they will handcuff your loved one. Again, this is a safety precaution. Your loved one is not under arrest. It's, again, a safety. It's safety for the police officer. Again, they don't know your loved one. Your loved one may be fine getting into the car, and then things change on the ride to the hospital. So again, I point this out so people won't be alarmed. Having to get a person help against their will for many people can be stressful. It can be very anxiety provoking. But I always like to say, if you had a loved one who was bleeding, would you hesitate to call 911? Would you hesitate to call the ambulance? Probably not, right? So look at the mental illness or the acute symptoms, the psychiatric symptoms, as this person actually bleeding is not a sign of weakness. I say that depression is a sign of weakness, right? It is a sign of weakness. What do you mean? It is a sign of weakness. It's saying that within your life there is a weakness, that's something that's out of kilter, there's something out of balance. And because that something is out of balance, you need to get the help that you need.
We think about socioeconomic status. A lot of people who come from a more high class have been introduced to therapies and mental health at a younger age, so it's a norm to them. And African American community is not really a norm or understand. So there's some a lack of understanding and misinterpretations around mental health that kind of hinder those in the African American community. It's not what I saw my mom do. It's not what I saw my sisters do. They don't talk about it at school, although I know that I'm going through this. The lack of financial ability to get services is one thing. There's more African Americans who are uninsured in America. So that's one of the factors that goes into the disparities within mental health in African Americans. Then there's all the homelessness, the societal thing. So in the African American community, there's much more trauma. There's much more things going on in social issues that impact their abilities to address mental health. So if I'm worried about me having some place to stay, I'm worried about me having money to feed my kids, my mental health is not always the number one priority right then and there. So, and then also
Black people are getting treatment. But based on what you're saying, it's hard to get treatment or to focus on treatment if I'm worried about where I'm going to eat or where I'm going to...
Mm-hmm.
Okay.
Where you going to eat, where you going to sleep, do you have food for your children, you don't have income, do you have transportation? And then, like I said, sometimes we'll say, well, the city supplies all these services, but are the services adequate? Do they meet a standard? We know that sometimes you say, okay, well, you can get transportation. Medicaid pays for transportation. Yeah, and I have to wait 3 hours for that transportation.
I would say for me personally, to get on the road of recovery, I literally had a breakdown, like a severe breakdown. That allowed me to start to get the help that I needed, because again, I was not able to verbalize what was happening. I just remember doing a lot of crying, and I'm doing things that are not rational, cutting myself, trying to kill myself, a lot of just not rational things, and a lot of emotions and a lot of things flooding through my mind. Like I can't even keep a single thought. And so having that breakdown, it started, okay, how can we help this? How can we help this girl? Like, what can we do? And it started me going to, finding, because at first, I was being diagnosed just by a general practitioner, my general doctor, and getting medication from her, but not being supported, where depression wasn't my only problem, and I'm only being treated one way, and then it caused other things to happen that just had me break down. So my recovery looks like in an open place where I'm getting the treatment that I need from psychiatrists and therapy, because I do both, and having the support of other people around me, and having that open communication with, you know, people who have questions that, you know, that maybe I can answer for them, and be that mouthpiece for them, as well as, you know, being stable, taking the medication. And I stress that only because there was a time I didn't want to take the medication, and I was doing more harm to myself than good. And understanding that the medication helps, and Nisi helped me with that, you know, like, you have to take your medication, baby girl, if you want to get better. And understanding that it's okay. Because, you know, I come from a background where taking medication, you were weak. It was, you know, like, we don't take medication, what is wrong, you know? So that's what recovery looks like for me. Just having that regimen of the people around me to support me, being open with my therapist and my psychiatry, and taking the medication.
It was not until after some time now, Joseph, he reveals himself to them and he tells them, don't be afraid, I'm your brother, Joseph.